It's a Health Topics Tuesday on SVI Media, once again sponsored by Star Valley Health, and Dr. Martha Hageman is joining us today with the latest update on COVID-19 and the coronavirus. Dr. Hageman, thanks so much for your time. I wanted to start talking about information to the public because in the day of social media, there is so much circulating around there, and quite often it's not very factual, and Star Valley Health has done a really good job trying to be proactive in getting out the facts that are accurate and correct. Tell us about the hotlines that are available, social media pages through Star Valley Health, and just to make sure that the public is getting correct information.
Great. Thank you very much, Duke, for having me and for asking that excellent question. So Star Valley Health has put together an actual live telephone hotline, where people can call in between 7 a.m. and 7 p.m. and actually speak with a human being on the other end to have their questions answered regarding COVID-19, and if they're having any particular respiratory symptoms or things, they can help to kind of guide people that way. So the hotline for information is area code, of course, 307-885-5008. If it's an emergency, if it's truly an emergency, call 911. We don't want people calling the COVID hotline if they're having a heart attack or a stroke or having an emergency.
As far as the facilities at Star Valley Health, I know that if a potential patient is experiencing symptoms of COVID-19 or what they think may be COVID-19, to call ahead before walking into the ER.
Yes, thank you for asking about that as well. If you are sick, if you are experiencing symptoms, fever, cough, body aches, fatigue, shortness of breath, we ask that you call first. And in particular, we would suggest you call either your individual provider or the hotline, the 885-5008, for them to then obtain some information from you, kind of walk you through it, ask specific questions, and then help guide where would be the best place for you to receive care. And it's very possible that even if you are experiencing some of these symptoms, if they're mild, you may not need to be seen at all. And it may be you may be given advice that you can continue to stay home, self-isolate, and do usual cares as you would if you had any other cough or respiratory illness. And so not everybody needs to be tested, which I do want to kind of stress to folks. And I realize that there's a sense of panic if we start developing symptoms that people immediately feel that they're concerned that they may have it and want testing. And the answer is, even if you're having symptoms, it doesn't automatically mean that you need to be tested.
Dr. Hageman, walk us through the visitor restrictions that are currently in place at Star Valley Health.
Sure. Certainly no visitors who are sick. For those visitors that are healthy, maximum of 2 visitors at a time. No visitors under the age of 18. The exception to visitors, too, is if a patient has confirmed or suspected COVID-19, then we will not be allowing any visitors or anyone to accompany that patient, again, because we need to isolate and that patient in specific areas of the hospital for the sake of public safety as well as medical personnel safety.
Dr. Martha Hageman with us today on Health Topics Tuesday, sponsored by Star Valley Health. And with those restrictions, I know that I understand at least that Star Valley Health has made some adjustments as far as operations and different things that are going on within the medical center and Mountain West Orthopedics. Sounds like there's been some changes there as well, correct?
That is correct. Mountain West Orthopedics has been moved to the Thane Clinic. So the Thane Family Medicine Clinic is where Mountain West Orthopedics is there because we have a X-ray machine there, and the other half of the clinic is still dedicated to our routine, regular family medicine patients. We are also really trying to shift towards more telehealth visits.
Dr. Hageman, again, talking about COVID-19. Let's spend some time talking about the community mitigation strategies, Dr. Hageman, and why are they so important? Social distancing is the term we're hearing a lot right now, staying home if you're sick. Why are these so important?
Very good question. Why social distancing is important is that we now understand that a patient may be completely without symptoms and yet have COVID-19, and they may not demonstrate symptoms at all or very few symptoms, and it may be that they feel fine for 2 or 3 days before they start having any symptoms. And for some people, their symptoms may be so mild, they may think they just have a regular routine cough or cold and not be aware that they have it. And so in order to really reduce the sudden spike of cases that we're seeing all across the country. We are trying to, as you hear from the CDC, we're trying to dampen that curve so it's not a sharp spike, because in our very small community, we're very lucky to be here, but we are a critical access 22-bed hospital. And if we have a large outbreak in this community, no matter what we do, we will not be able to meet the needs of patients that are critically sick. Because we, again, 22 beds. If this were to go unchecked and if we weren't doing social distancing, there's a possibility that 300 patients could need to be hospitalized at once. Do the math. 22 beds, 300 patients, it doesn't work. So we're really trying to avoid that. The social distancing, hand washing, avoiding any discretionary travel, staying at home if you're ill, limiting the size of gatherings, and telecommuting to work when it's appropriate. And as we mentioned earlier, telehealth visits may also help to curb or reduce the chance of spread of this virus.
That's Dr. Martha Hageman with Health Topics Tuesday, sponsored by Star Valley Health. Dr. Hageman, thank you so much for your time. We appreciate it.
Thank you, Duke.